Welcome to the Global Health video class. My name is Dr. Elvira Beracochea. I'm the President and CEO of Realizing Global Health. We are a consulting company. We work in global health to deliver quality health care for everyone, everywhere, every day. And today the topic is the last topic in our series of the 7 components of building a sustainable, self-reliant health system in a country that can grow, that can develop, and that can serve its people in the way they should be served. And the 7th component is partnerships. The first component is the health system, the structure of the health system. The second component is the health programs that are run through the health system to make sure that then they are transferred, they are translated into services that are provided by health providers, doctors, nurses, different health professionals that form the health team. And finally, number 5 is the ownership, the leadership of the local authorities, the country's leadership and ownership of the whole development of the health system process is essential for the system to grow and become a self-reliant, sustainable health system. We talked about the importance of having a community-based approach to developing the health system. And finally, today we're going to talk about partnerships. Nobody can achieve anything on their own. We all work in partnerships. Some are better than others. So we're going to talk about what really makes a good partnership. Donors, governments, health providers, professional organizations, faith-based organizations, civil society, private sector. Everybody has to work together because we're all part of the same country. We're all part of the same planet. We're all part of the health of the human species. So we have to work together. We're not going to go to another planet, so we have to improve this one. And to work together, I always advocate for the 3 C's. The 3 C's are communication, coordination, and collaboration. So all the partners, everybody that is working in global health needs to work together. They need to communicate what they're doing. And sometimes it's not just enough to put it up on your website or to write a report. You need to actually communicate and spend time sitting down with everybody that is impacted by what you're doing to make sure that they are aware of what you're doing and you understand what they're doing, where their pain points are, and how you can complement each other. The second point is to coordinate. So it's not just enough to plan a very interesting training program of community health workers. You need to coordinate with other people that are also training, in particularly the country's training institutions, the medical schools, the School of Public Health, the nursing schools, public and private. How do you coordinate what you're doing to make sure it complements what the others are doing and strengthens the country? And finally, it's collaboration. How can you then not only communicate what you do, coordinate what you're doing, also collaborate? And you do that by making sure that everything you do is under the umbrella of the national health policy. What is the policy in terms of training? And if there isn't one, let's help create one. And what is the policy for family planning, for child health, and HIV/AIDS? And if the policy hasn't been updated, let's work together. Let's collaborate to make sure it gets updated and it's up to standards. The next component is that you need to be part of the same health plan. Every year, countries develop their health plan for the year. They also sometimes have a long-term strategy, a long-term plan, usually a 10 or 20-year plan. And how does what you do complement what they're doing? Where do you fit in that plan? Make the effort to make sure, be a good partner by identifying where you contribute and making that known to everybody. Then the next step and the next level in collaboration is to be part of the national budget, the national health budget. So if you do something, make sure that that money is accounted for and it's contributing to the national health budget. So we know where the money comes from. We know how the money is working. And if your project ends, make sure start 2 or 3 years before the project ends to make sure that those activities that you implemented are then included somehow in the health budget for the following years. Don't drop things. That's not professional. And the fourth element of a good collaboration, of good partnership, is making sure that you are accountable for everything that you do and that you are really contributing to the national health system. We know the health information systems in most countries are weak. They have their weaknesses. So how can your work contribute to strengthen that? Maybe it's because in the district where you're working, you contribute to improve it in that part of the country. And then by coordinating and collaborating with others, then the same approach can be done by others. So remember, you need to be a good partner. So what does being a good partner mean to you? Now it's the last day of the year, so I ask you to think back the beginning of the year, 2014. What did we do that made us a good partner? Where maybe we didn't anticipate ways of taking advantage of being a good partner. So make it better for next year. I want to wish you a very happy New Year's Eve and a very, very prosperous and peaceful 2015. I'll see you next time. Bye-bye.